Myself, Dr. Jibran Ahmed presents to you Simply Pathology, and today we are back with a very important lecture. Now, this particular lecture are basically for those people who are going to appear for your examinations both in month of May for the odd batch and in the month of September this year. So basically, I'm talking about the MD DNB pathology exams. Okay. So what is very important here to consider, because recently, in the month of December 2024 and this year January and February, many of you people have given the exams. Okay. And basically what this lecture is about, this lecture is basically concentrating on the different kinds of mistakes that you have made during this particular exam. So all of all the students who are appearing for this year, and even the first and the second year students, please pay a lot of attention over here. You have to learn from the mistakes that other students have made. Okay. So I would like to highlight some of these very important mistakes and also some important tips and tricks which are very important for you to keep in your mind. Okay. When you are appearing for the MD DNB exams. Okay. So please pay a lot of attention. This is a very important eye-opening lecture. Now, what is very important, that you should avoid some of the very commonly made mistakes in the exam. Though I have been speaking about this from a very long time, but yet I see a number of students are making these mistakes yet today. Okay. So the first thing that I cannot lay a lot of weight on, or that I cannot say enough, is the fact that you have to start early. There is no substitute for revisions and consistency. So you have to revise what you have learned. You have to consistently do it. Okay. So what we have seen, not only this time, but also we have seen, in the past 3 years also, in the last 5 years, okay, from where we are active, what we have seen, that most of the students, okay, they know about us from the first year. Okay. So they are like, okay, they are doing the departmental work. They are very, calm, they are very, they are very casual about it. And we see that a number of students, okay, they join in the last 6 months, and even more number of students we see that they are enrolling in the last 3 months, and even a more number of students we see even 1 month before the exams they are joining our course. So I try to understand that basically like how you would prepare in a month or in a 2 months time. It is very difficult to imagine for me. So you have to understand that our course, they have different planning for 3 months, for 6 months, for 9 months, not for 9 months, for 12 months, and for 1 year and 2 year plan. So try to understand, when we are giving a 3 months plan, it is not like we are suggesting that in the 3 months plan you can complete the entire course. No. In the 3 month plan, you are able to revise whatever you have already learned. So 3 month plan is basically introduced because it is of lesser cost. So it is easy for you to subscribe on a 3 monthly basis. It doesn't mean that the course can be completed within 3 months. Not at all. Okay. Minimum amount of time that you require to cover the course is 6 months. Okay. With revisions and with everything that you can take a you can make a meaningful impression out of it in 6 months. You can go till 1.5 to 2 years if you try to complete the syllabus, okay, comfortably. So that is why I need you people to understand that 3 month, okay, is for revision. I have taken out one video, 90 days revision program. Okay, that is a revision program. It is not a program to finish the syllabus. Okay, MD pathology course, it is a 3-year course. Okay. So whatever things are there, okay, in MD pathology, whatever heading, general pathology, systemic pathology, cytopathology, hematology, recent advances, clinical pathology, grossing, tissue processing, as well as there are so many different subheadings. Okay, so there are lots to cover. It is not possible humanly to cover everything in the 3 months plan. So remember, the 3 months plan that you are enrolling, okay, it is not, and leave the plans, okay, leave the plans. What I want, I'm not over here advertising that you should come and you should join Simply Pathology. No, don't take it in that way. You take it in that way that in 3 months, you are not able to complete, everything, from the beginning to the end. You cannot complete in 3 months plan. It is a 3-year course. At least it requires 1 to 1.5 years of active reading for you to understand the subject. You cannot complete the subject in 3 months time. So when you try to complete each and everything in 3 months, what happens that you become overwhelmed. You have read so many things. There are so many things in your mind, but you have not had the time to revise all the things. So the problems will start then. That is why I have always maintained for the last 5 years, I am shouting on top of my voice that start early. Doesn't mean that you have to come and join our course. No, doesn't mean that you join our course. I am telling you as an outsider, okay, leave the Simply Pathology course. You can pass even if you do not join our course. It is not a big deal. The only thing is you have to have a particular approach for that. Okay, that is the main thing that you should have. So the thing is that you have to start early, whether you enroll with us or you do it without us. Okay, that is up to you, but you have to start early in any situation. Because if you do not start early, then your syllabus will not complete. If your syllabus is not complete, you cannot start the revisions. So that is the one important thing I tell everyone. Okay, those of you who are watching this video, the first and the second years, please start very, very early. Do not listen to your seniors. Do not listen to any faculty member or any person who tells you that you have 3 years, you have a lot of time, you don't need to read now. Please do not do that. Especially the seniors, they are misguiding the juniors. I have seen in many cases. Please remember this fact. 3 months is not enough to complete a 3-year course. Okay, this is to be completed. At least you need 1.5 to 2 years of time to diligently read, understand. And please, I have said this thing before as well. First year is the only year where you get the maximum time to read. So those of you in the first year or who have just gone in the second year, please take this with a big caution. The second important thing is, as I have already maintained, that revisions and consistent revisions is the key to passing the MD DNB exams. It is very, very, very important. Now I will give you a figure. Okay, basically in my other videos I have already maintained and I have already said that MD pathology passing rate, okay, for the MDs, okay, is usually more than 96%, okay, in the MD pathology, and for DNB it is more than 90% pass rate is there. Okay, so basically the pass percentage in DNB is a bit less in compared with the MD. Okay, but remember, it is not like if the pass percentage of MD is more than 96%, that means MD is very, very easy and DNB is very, very tough. No, it is not that. Okay, even MD is tough, even DNB is tough. The basic thing is why we consider DNB a bit tough. Why? Because the practical examination center is not in your home, in your home medical college. No, it is in some other state. So it becomes a bit difficult because the examiner doesn't know anything about you. He will just come to see you, okay, when you have come for the exam. So he doesn't know anything about you. He cannot gauge or know, because in the exam it is not always that you can recall everything and you can answer. Sometimes you can make mistake. You are a human being. So in MD exam, what happens that the teachers and everyone, they are known to you and it is a little bit easier to pass the practicals. But in DNB it becomes a bit difficult. Okay, so I will give you some example from our Simply Pathology. So at Simply Pathology, okay, whatever we have seen, okay, and our source of knowledge is coming from whatever whatever type of feedback we are getting from the students. So the DNB exams last year, okay, whoever have given the DNB exams, okay, as you know, the DNB theory exam is separate and practicals happen nearly 3 months after the theory exam. After you clear the theory exam, then the practical dates come and then the practical exams are carried out. So for the DNB in the last academic year, as we see, around 93 students, appeared, and there is a 100% pass percentage as per our knowledge. Okay, if anyone has not done well and have not cleared the exam, then you might contact us as well, because as per our knowledge, the number of students who have actually who have contacted us, as far as we know, everyone has passed. So there is a 100% pass percentage. But right now till date, okay, in the month of December, January and February, around 1500 residents have given the exams, and many of you have done very well and we are very pleased. Okay, so I would like to say that congratulations to all who have passed, and those of you who have got gold medal also, and those of you who who have done brilliant, you have scored very well. Okay, many of you people have scored above 65%, if you have scored even above 75%. Okay, so these are really good numbers, when you consider the MD nature of exam or the postgraduate nature of the exam. Now, what is very important that many of the MD pathology students, okay, they are under the impression that because we are in the MD, pathology course, so it is, it is very easy for us to pass. It is not like that. Okay. Yes, MD pathology in comparison to DNB, it is easier to pass, but it is not a cakewalk. It is not a free pass. Okay, that you have just come, given the exam, you will do anything as per your wish and you will, pass. So this is the message I want to give you people. Okay, so do not overestimate yourself, or do not think, or do not take MD courses or MD pathology course very lightly. Okay, so remember, MD pathology is easy to pass provided you also read. If you do not read and do not write anything properly in the exam, so they will fail you. And right now, out of the 1500 students who have actually given the exams, many of them are awaiting results as well. So basically, we cannot give you a completely correct pass percentage. So right now, at the current moment, it is around 99% people, 99.5%, more than 99.5% people have passed. Okay, those who are enrolled with the Simply Pathology. So 5 or 6 of them, that as of now, as per the current knowledge, okay, they have not made it, and they are not able to clear the exam. Now, what is very important, you will see that many institutes or apps, they always post about who have got very good marks, who have scored distinctions and everything. But I think this is the first app where I am personally addressing, okay, that where the mistakes were or what mistakes happened. Okay, for those individuals who are not able to clear the exam as per our database, as per our knowledge, as per our speaking. So this video is regarding what mistakes you should avoid. You have to learn. Okay, so the very important thing over here is one of the resident, okay, as I know, had suffered one accident, so he was not able to sit for the exam. Okay, one other resident, okay, he was not eligible for the exam because she was from the COVID batch, and therefore her tenure was not complete, so her exam has been shifted to the odd batch. Okay, so this was this. So effectively, if you see, there are 3 individuals who have actually not able to pass the exam. Now, what happened, what went wrong? Okay, try to understand. So one of the students who did not make it, she told me that they were not able to complete the question paper in time. She had said that she was writing very slowly, and she has written short answers. Means if you were to supposed to write a big around 4 pages, she has written just 1 page. Okay, she has also missed many questions. So yes, as I have always mentioned, that time management is very, very, very important. You have to start writing, and for this reason, what we have done, that the recent advances part of our Simply Pathology, if you see, we have not given you access. Previously, we have given you access to all downloadable notes, but right now, if you go through our application, the recent advanced part, we have given you very nicely the readable PDF. Now you have to take the effort to write down, because if you are not writing down, you do not have the practice, and if you don't have the practice, even if you know a particular question, you are going to miss it in the exam. Okay, and this particular student, they were had done brilliant in the practicals. Okay, even I think she was the second topper. Okay, second highest she had scored in practicals, but because of this time management, she was not able to pass the exam, and it came as a shock. Secondly, one of the students, okay, though she passed in the theory, this is very rare case. This is the first time I have seen that someone has failed in the practicals. This is the first case I have heard, failed in the practicals. So the student went in shock. Okay, it was a shock for the student that she has failed in the practicals, because she said that out of all the vivas she had given, okay, she had made a lot of silly mistakes and she was quite nervous. Okay, so that is why we always say, have a proper sleep before your exam. Okay, be calm and composed in your exam. Sometimes you have done everything correct, and but because of the lack of sleep and because of the nervousness and the fear, you tend to make things worse. Okay, suppose you already know something, but you write something else, you start making a lot of silly mistakes. So you have to be very calm when you are giving your exam. You cannot make a lot of silly, okay, one or two silly mistakes are there, but if you make a lot of silly mistakes, it can take a toll on your exams. Okay. So anyways, silly mistakes, nervousness, they can be encountered. But one other reason that the student has said is grudge. So she had mentioned that, for example, she had done something inadvertently. Inadvertently means she did not want to make a bad comment or back chat against a particular professor and HOD, but she did, and she back replied. Okay, she replied and she argued with the HOD when she was in the first year. So from that time till now I do not know whether, I cannot claim, this is what reviews I have got back. So I'm discussing with you people, okay, and I've maintained complete anonymity regarding the same. I was giving you. So I have always maintained that you have to be very careful during your residency. Do not backchat, do not argue, do not, especially with the faculties, okay, do not create a bad impression, because sometimes it can be taken as a grudge, and sometimes, because it, in our country, in our setup, in most of the examinations, the student, there is no option for challenging the paper or to for recheck. I was quite surprised about that, because if a particular university is checking or giving you pass or fail remark, then there should be an option for the student to at least see where the student has gone wrong, so that the student can correct them, correct their actions the next time. Or sometimes theory paper recheck is there, but usually practical recheck is never there, as I have not heard. So please keep this was one of the major reasons given by one of the students. Another student failed in theory. Now what was the student's remark was, the student has basically joined, and all of these students who have actually failed, to be very honest, they have failed mainly in the theory, except this one who has failed in practicals. And very importantly, if you see, most of them, they were enrolled or they have come in contact with Simply Pathology in the last 3 months of their exam. So when you come in contact in a very late stage, so as I told you, in 3 months time, it is not possible or feasible to complete each and everything in such a short period of time. You come or you don't come to us, it is not a problem. But suppose if you plan to come in the very end to us, and if before that you have read a lot of things, you have, for example, say completed general pathology and hematology, for systemic pathology and for a little bit more knowledge and update you came to us, that is a separate scenario. Okay, so it is not like all the students who have joined in the last 3 months with us, they have failed or they have done badly. No, many of them, they have done beautifully well. Why? Because they have been reading in the last 3 years. So if you come and if you have a mindset that I will only read in the last 3 months, that is a wrong approach. So I hope you can understand what I'm trying to, what point I'm trying to make. So again, the student have failed in theory. He could not recollect the common questions, okay, went blank in the exams. So that is why what happens, that when your revision is not correct, like if you have just one revision, for example, before the exam, means you have read it once and then only one revision you had. So how do you expect to recollect? So you tend to mix each and everything, and therefore you are not very coherent in your approach to write the answer. So as a result, there are a lot of issues that you are going to face, and the examiner thinks that you are confused or you have not read properly. So this is a very, very big issue. So if you have at least you require 4 to 5 revisions before your exam. Even 3 to 4 revision is not enough. It is not MBBS level, it is a postgraduate level. And with the increased number of molecular pathogenesis and molecular alterations, it has become more difficult to remember each and every of these points. So that is why I have always maintained you have to revise. Revision is the key to success. Okay. Now there was one other student who has not done, but I am not counting that student because the student has joined us for 3 months plan when the student was in the first or in the second year, and the student has actually not actually studied very well and actually is not a very actively reading student. So that we have not taken into the account because that student by itself was not very interested in the subject. So that there are some cases that you are already prepared and you understand that this person, if that person passes, then it is his luck. So most of the people, they will fail in theory, In practicals, remember, there are lots of room to make improvement, provided there is not a problem, or you have not created any problem for yourself with the HODs or with the professors. Okay, so but remember, any mistake you make in the practical, okay, the examiner and everyone, they can overlook that, okay, and they can pass you. Overall, they know you for the last 3 years, so they will pass you. But in the theory, if you do anything wrong, please note, there is no other way to pass you in the theories, because the examiner has to pass you or give you marks based on certain criterias, and he's not giving, for example, one question, he's giving the full marks over here. He has to give separate marks for each of the topics that you are writing. Now, for example, there is a question that you do not know an answer to, and if you have not written anything, so there is no room for examiner even to give you 2-3 marks or 4 marks. Okay, so as a result, what will happen? Out of 10, you will get a big 0. Suppose, like for example, what happened with this student, she failed with only 3 marks. Okay, in paper number 1, she failed with 3 marks only to spare. Now, suppose some question that she has not written, 3 questions I think she had not written at all. So if she had written, okay, something, 1 page also in the 3 questions, and for the 3 questions, the examiner gave 1 plus 1 plus 1, the examiner gave plus 3 for those 3 answers, at least you wrote something, the examiner gave you 1 mark out of 10. So that those 3 numbers would have helped her to pass the exam. So that is why I always say, do not leave any answer blank in the exam. Theory is very, very important. The third important thing I will tell you, the problem that students have faced, and this is not something that is new. If you go and see our videos from the last 5 years, every year we are making a video how to approach the exam, and every year we are telling the same thing. So remember, the NMC, they have made a pattern that paper number 1, 2, 3, 4 like this. Paper number 1 is based on general pathology and molecular pathology. Paper 2 based on systemic pathology and the recent advance. Sometimes they are including recent advance also. Paper 3 hemat and cyto, and paper 4 is the recent advances, dedicated paper for the recent advance. But what is happening if you see that this is not followed uniformly across the country. Some universities are following very nicely. Some universities, they are not following at all. For example, I will give you, this is a WhatsApp message from one student who have given us this screenshot. If you see that paper 3 syllabus came instead of paper number 2, full hematology and cytology instead of systemic has come. So as I have already maintained in the 90-day videos, I have told you the same thing. Look at these questions, what they have asked in paper number 2, automation in blood bank, role of frozen section and squash cytology in CNS tumor. Discuss immunodeficiency associated lymphoproliferative disorders. Okay, short note on von Willebrand disease, short note on APML, define thrombophilia. Okay, short note on hypereosinophilic syndrome, right? Lab diagnosis of sickle cell anemia. So basically, if you see over here, around 95% of the questions are very easy and common, but completely, instead of giving them in paper 3, they gave them in paper number 2. So this is the extreme form I am saying. It is not like this is going to happen with each and every student. Please note, it is not that out of 100 universities, all 100 will have this, but maybe out of 100 universities, 10 universities may do something like this, or maybe 1 or 2 will do like this. But what I'm trying to say, that some questions from paper number 3 may be added in paper number 2. Similarly, some questions from paper 3 might come in paper 1, and vice versa also. So 1 or 2 questions here and there is very common and will be seen in across all universities, not something new. So what happened with this student? This is a very, very studious student, and she is one of the very good students and diligent student, and she used to revise very well. And you will not believe, still the student, okay, in spite of all these things, the student was able to do well. Why? Because she was constantly revising, constantly reading in the last 3 years. Okay, this is the most important point that I want to make. Okay, now why for example, when a student is coming across these things, or sometimes you people feel a shock that NMC has given us this, but the university has given us this. That is why we have always maintained that see the last 5-year question papers to see the pattern, what is coming where. Once you look at the pattern and you even ask your HODs and professors, remember, whatever the NMC guideline is there, all the universities in across the country, they are not following the NMC guidelines completely. Yet, for example, there are universities who are giving 25 marks long answer question. One university gave 50 mark long answer question and remaining 10 short answer note. Okay, then remaining 50 marks they have given short answers, each 10 marks. Okay, so this pattern is also there. But in most of the universities it is of 100 marks and there are 10 questions. Most universities they are like that only. Now look at this particular paper. This is the paper number 4 that is supposed to be a recent advanced question. It is a paper basically of 2025, as you can appreciate. It is a 2025 paper. Okay. Now it is saying it is a recent advanced question and I completely accepted. This is recent advanced question of histopathology. Okay. Again, this serrated lesion of colon and rectum, this is also a recent advanced question of histopathology, but it is also a systemic pathology question. Hemovigilance, recent advanced hematology question. Okay. Updates in PFT, platelet function disorder, again, okay, it is a recent advanced, it is actually a hemat question, but okay, we will accept recent advanced question. Molecular profiling of breast carcinoma, again a systemic pathology question. It is also given in one of the recent advanced histopathology. Rare coagulation disorders, again it is a hemat question. Recent updates in Barrett esophagus, it is again a recent advanced question of histopathology. Applications of plasmapheresis, again a hemat question. Paris system is a direct cyto question. So if you see out of 10 questions, if you see 5 to 6 are direct questions from your recent advance and 3 to 4 questions if you see they are basically from other papers like from cyto or they are giving from hematology like that. Okay. Now the problem with this is in 2025 they are asking you recent advanced questions from recent advanced 23 and 24, and these recent advanced 23-24 they came in between 2010 to 2013. So it is nearly more than 12 years old. So even after that, all this recent advanced 23 and 24 has been discussed, the notes of which are already present in the website, and I have also made a dedicated recent advanced video wherein recent advanced 23, 24, 25 and 26 have been included. Not a single question has come from recent advanced 25 or recent advanced 26 histopathology. Neither a single question has come from the recent advanced hemat part 4. Okay, although we have also covered both of them this year only for this year exam appearing students. So again I am telling you what message that you are getting from here, that questions usually from between the different paper 1, 2, 3 they can come in other sections. That is number one. Second thing is that it is not that recent advanced 24, 25 has 25, 26 has come, so I will not read 23, 24. Over here this is a very easy paper. A very easy paper, good set of question, but the thing is it is not very recent. So we have to know about the future and we have to know about the past as well. So you have to complete recent advanced 23, 24, 25 and 26. So anyone who has read 25 and 26 thinking that 23, 24 is not important, which he has done correctly, but in our setup, because paper questions are repeated from the last 5 years, so as a result it has been repeated. Okay. So if anyone would have read 23, 24, he would have scored more than distinction over here in this paper, because all the questions are very simple, very easy, very straightforward. Okay. But as I told you, these are the issues. These are some of the issues that is actually there. Okay. With regards to the question papers that I have already made. So this is about your, that there is always a mismatch with regards to the questions asked in the exams. Okay. Not so much. This is one of the extreme versions that I have said, but even though if your revision is correct, if you read properly, if you are thorough in your approach, then even such a disastrous event can also be overcome. This is a very extreme event. It will not happen with you. It is in 1 or 2 papers out of 100, papers. Okay. Now the fourth important point I would like to discuss is that sometimes, and this year also it is not exception, every year some of your papers in some of the universities are quite tough. So suppose usually as I say that 7 to 8 questions, or let me just repeat, 70 to 80% of the questions they are very easy and mostly they are from the repeat commonly asked question. Rest 20 to 30% questions they can be new. This is the standard approach. Now sometimes paper can be easy that 100% of all the questions are very easy and you have attempted all the 100 marks properly and you got a very good marks. But sometimes the situations can also be that only 50% of the questions asked, or maybe sometimes 40% to 50% questions are easy, okay, that you know, and the remaining 50 to 60% of the questions, they are new. But remember one thing, if it is new, if it is out of the box, so it is out of the box not only for you. It is tough not only for you, it is tough for everyone. So they cannot fail everyone. In that scenario, if this something like this happen, they will have to fail everyone who is sitting for the exams. They cannot do that. So anyone who had got a very difficult question paper, okay, they all passed. Okay, I have not seen the, especially I was worried about those universities, but those universities, in which students got a very difficult question paper, one or two paper was very tough. So I have seen that all of them have done very well. On the contrary, they got more marks. Okay, so this is also something that happens. Okay, so please keep this in mind. Now, one thing about the 5-year question paper that I have always maintained from the beginning, that please go and see the last 5 to 7-year question paper. Okay, I have always stressed on them. I am not denying that fact, and today also I am saying that this is very important. Last 5-year question papers is very important. But remember, I have never mentioned that please only do the last 5 to 7-year questions. No. This is the bare minimum that you have to do for passing the exam. The last 5-year questions is the bare minimum that you have to complete them. And why? What is the importance of this 5-year? As I told you, you get to know the university pattern, how they are asking question, whether it is a 10 mark question, or it is a 25 mark question and then short notes, or it is a 50 mark question and you have rest 50 marks as short notes. So in that case, you have to understand the pattern. Without looking at the last 5 years, how do you understand the pattern? You will never be able to understand the pattern. So last 5-year to 7-year questions is the bare minimum. That is why I have made a video, special video about 90-day revision plan video. It is already there in YouTube, and I am also give the link to that video in the description box of this video. So in the 90 days revision plan, I have spoken in details about all the important topics for your exam. And if you go and see all the papers for this year, 95 to 100% of the questions, they have come from there only. So this video is very, very important for you to go through. So the 5-year question paper is acting as a guide for you. It is a guide. It is not like I have done the 5 years, my work is finished, is all right. Now this is enough for me. 5-year question paper is giving you an idea. Okay, not only an idea about the pattern of paper, but also what are the important things that I should know as a MD pathologist also. So it is also guiding you towards your residency as well, as to what to read and what not to read. Then, as I already told you, as I've already explained you, now I am going to details of this part, that time management is very important, and often it is a very underrated point. Remember one thing, most of the students who are failing, they fail in the theory. And most of them who fail in them theory, it is not like they do not know the answer. Most often than not, they are not able to write the answers properly. They mix up, they juggle. The questions are easy. They have read them, but they were not able to revise them properly. As a result, they are not able to write the answers properly. So I will try to make you understand how much it is important and how you can overcome this. So many have failed in theory due to the poor time management. Many have failed in the theory. So most of them, they know all the questions, but they could not complete in time. This is a very, very common scenario. Now I will give you an idea what actually is the meaning of time management. Now suppose you already know this thing has to be done before the exam, not on the day of exam. Okay. So suppose you have seen the last 5-year question paper. Okay. And what you saw that, for example, you are getting a 100-mark paper and you are getting a 10 questions, each of 10 marks. And you are having 3 hours time. Now 3 hours time means you are having 180 minutes. So that means if you have 180 minutes, then for each answer you are having 18 minutes, right? So this is the average time that you should give to each question, while writing your exam. Now it might be certain questions, for example, I will give you one example. There is a question called discuss, classify diabetes mellitus and discuss in details about the pathogenesis of diabetes as well as the long-term complications. Now this answer, although they have given for 10 marks, this is a very elaborate and long answer. So basically this answer might take more time. Okay. But there might be some question as well which will take less time from you. For example, they will ask you classify the vesiculobullous or discuss about the vesiculobullous lesions of the skin. They are very short, 2 page, 2.5 page, 3 page answer, finish. This answer might go, the diabetes mellitus answer can go till 10 pages. I got this question in the exam, not once but twice. In paper 2 also I got, in paper 4 also I got diabetes mellitus. Okay, in both the papers I got. Okay, so some answers will be long, some will be short, and if all the questions are very lengthy or all the questions are big, so you have to improvise there. And how to improvise, I am getting. So if the answer is very long, so you have to write it in short. Okay, you have to just write down the headings, write 1 or 2 points, and try to cover all the points rather than elaborating 1 or 2 points. You cover 10 points and write 1 line of each rather than elaborating 1 and 2 points and writing 1 page each. You understand? So where does this ability for writing concisely comes? So in the exam, you can have both the situations. Okay, one is you have a very long answer, you have to write concisely, and sometimes you have a lot of time, and sometimes the question is actually very short but it is of more marks and you have to write elaborately. Now for both the conditions, to write concisely also and to write elaborately also, you need to have a lot of knowledge and you must have had revised that topic many times. Only when you have read a certain thing a certain number of times that you can manipulate those information as well. So you can make something very short in a very small period of time, or you can also elaborate those things. But if you have read only once or twice, okay, even 2 times reading is not enough. So what will happen? You are going to mix up. You are writing some answer in your memory, you are going to mix it up with some other. So there is something called as long-term memory. So whenever there is a short-term memory, there is a long-term memory. So whenever something goes on repeatedly, okay, so short-term cycle going on, it will be converted to the long-term memory. Okay, understand this point very, very clearly. Now I will give you one example and I can prove you also. Suppose there is a playlist of song and you are listening that song for the first time, that particular playlist, and everything is basically arranged. All the songs, they come after one another. So when you listen to those group of songs, suppose today is the first day I am listening to those playlist of songs. So you're doing some work and you're listening to your music. So on the first or the second or the third day when you're listening the songs, you might not be able to understand or say which will be the next song that will play. But once you hear those songs repeatedly, after 1 month you will see that you are like, suppose one song finished, your mind, you can contemplate which next song is going to play. Why? Because the mind loves when things are in proper arrangement. So whenever you read again, there are slots in your mind where all information are stored in a particular area and you remember where it is stored. So that is why when you recall, you can recall in a very nice manner. So this is the importance of revision. So when you revise a lot, when you know a particular details, when you have read about something in great details, depth, and completely you have read it, in that situation you are able to write very fast because you can recall very fast. So the problems that I am very slow, I am not able to do, it is coming up with 2 things. One, the habit is not there for writing. Second thing, that the revision is not there. So when the revision itself is very less, you tend to think and recall and take more time, and that leads to mismanagement of time in the exam. Also, if you don't know a particular answer in the exam, don't leave it completely blank. At least 2 pages you write something. Okay, at least something you write, because as I told you, those 1 mark, 2 mark, 3 mark may help you pass. Okay. One more thing that is not written over here, but that has hit my mind right now, is the fact that whenever you see a question paper, you can answer in any format. Like the questions are 1 to 10. So you can answer the question number 2 first, then you can answer 6. Just you write down, this is answer number 2, answer number 6, like that. So what I used to do when I used to see a paper, suppose there are 10 questions, okay? And out of those 10 questions, maybe 6 of them I know very well. Maybe question number 2, 5, 7, 9 and question number 10, okay? And for example, question number 3. Suppose these 6 questions I know very well. So what I will do, I will first complete to write these answers, because these answers I know very well. But for example, the answer number 3 or answer number 4 or answer number, answer to question number 6, okay, or answer to question number 8. So these are some difficult and I will have to sit and I will have to think. I know something about it, but I am not very sure. So you answer these questions in the end, okay, because these things that you already know, you write them down beautifully, so that your 60 marks out of 60 marks, okay, you secure at least 50 marks, okay, that is there. Now with the remaining questions, maybe for question 1 you got 3 marks, for this you got 4 marks, this you got 1 mark, this you got 3 marks. So for example, in total, along with the 50 marks, for example 7, 10, 11 marks got added and you got 61. But suppose you have not attempted any of these questions because you were not very sure, then you have to get 50 marks, and 50 is the passing mark. So this is the thing that you have, this is how you have to approach in the exams. Now the point number 6, very important thing, the professors, HODs and the examiners, they are always right, no matter what. No matter what, they are always right. Do not argue with them unless and until, for example, someone is really harassing you, or someone is mentally trying to torture you or targeting you, or there is a vindictive behavior is there, okay, vendetta is there against anyone. So in that situation, there are some legal procedures, or you can raise the issue with the with your head of institution, or with particular boards are there for the well-being of the residents. So you can raise issues in that sense, in that scenario. But in usual, some kind of issue will always be there, because these professors and HODs, they have a lot of experience. And what happens, you may say or back chat, or you might argue with a particular teacher and say anything like, and you may forget about that. But the HODs, the professors and the teachers in your college faculty, they will never forget. They will always remember in the back of their mind. So remember one thing, I'm not saying that you have to completely do as their wish, or everything they are saying. What I am trying to say, that those are teachers and they have worked very hard to be in a position they are, right? And you are just joined in. So what happens, absolutely their wavelength and your wavelength is never going to match. They are from a completely different generation, you are from a completely different generation, okay. You might not like some of their behavior and they might not like some of the behavior, but they can express, the teachers can express their discontent with your behavior, but you cannot, or you do not have the you do not have the right to say anything against of them. So try to understand this thing, that the teachers, they are in a position, they have some respect and everything. So you have to be very cordial and graceful in your behavior. So I have always maintained that you be neutral in your behavior, be professional and be graceful. And I have always maintained, never mix your personal life with your professional life. Where you are going for work, your co-batchmates or whoever they are your colleagues, okay. After college, maybe they are your friends, but remember one thing, first and foremost, you are colleagues. What happens that when you say something or you disclose some information to your colleague, that is going to go through the entire department, and that is the last thing that you want for yourself. You don't know what you have uttered. Even sometimes you don't know that something that you have said, you have uttered, may offend a particular faculty. So it is best to keep your mouth shut, stay neutral, be professional, be graceful, and don't argue, because this is not the first time. Last year also there was one student, and they were feeling that the student was topper in practicals. She topped the practicals every time she gave the exam. She was able to clear her MD exam the 3rd time. They failed her 2 times without any reason. And she used to top in the practicals in all the paper, in all the exam. They used to fail her in theory. So that was because of some other scenario that, that we cannot help about that, but I can show you a proper path. Remember, I'm not saying that the faculties and whoever they are there, they are against of you or something. No, I'm just telling you, they are at a different level. They are at a different generation. They work very hard to be where they are. Okay. And especially all the mistakes you people make in the first year. As I told you, you have passed the MBBS. Once you pass the MBBS, an MBBS student, they show no respect whatsoever. I have spoken to so many undergraduate students. Some of them, they called me bro. Some of them also shout at me. Some of them, they have such a very weird and bad behavior, lacking respect. So I can understand if they are behaving like that with me, then they must have had the same behavior with the faculties as well. So what happens that in the first year, you have just, you are an MBBS itself. So once you enter in any kind of course, yet you do not understand the working of the residency program. You don't know the faculty, how the working of the department is, and you are yet in that particular phase. Okay, I am an MBBS, I have taken out one seat, okay, or I have taken got a private seat or whatever. So you are at this level, and once you go there in the first year, from this level you are thrown down to this level. So you are very frustrated in the first year because you have to do the clerical work and everything. And at that particular juncture, when you are the first year student, you have those MBBS things in your mind. Okay? So you are not accustomed to working such long hours. You're not accustomed to a job like scenario, most of you. So as a result, what happens that you tend to make a lot of mistakes, back chat, and even argue with your residents, with the seniors, juniors, or you may start to argue with the faculties as well. So do not do that. Refrain from that. It might happen, some incident might happen in the first year, but the faculties will remember that. And if you do anything against one faculty, it is taken as something you have done against all the faculties, because they are at one par or at one level. So always respect your faculties. They are your gurus. Okay, remember that point. They are not your friends. Okay, they are your gurus. They are, and because it is not America, it is not Europe where you can call a teacher with his name. There are many students, who call me instead of saying, I am fine with Dr. Jibran. Anyone calls me Dr. Jibran, it is not an issue at all from my end. But that might not go well with the other faculty members or the HOD. So please keep in mind those things. You don't go and you say, so and so faculty by their name. No, you have to give that due respect that they need. And in our Indian institute, Indian setup, culture is very, very important to maintain. Some tradition, culture is a part of our society, especially with the professors and the HODs, okay, who are actually in this field for a very long period of time. Okay, so keep this in mind. Now, as I've always maintained that revision is a big key. Now, till now, I've advocated for reading. Why am I saying that? You read as much as you want, but also remember you have to take some time to relax as well. You have to eat something or do something, or something that you like. Okay, remember, fear is the worst enemy. If you are always fearful, I will fail, or I will not be able to recall, I will not be able to do this. You know why this fear comes in? This fear comes in because you are not taking any action. So when you are not taking any action, then the fear comes in. How I will pass, what I will do, how everything will happen. So fear is coming out of inaction. If you make a plan, okay, these are the topics I have to complete. Sir has given this 90-day revision program. I will do that. Maybe in that 90-day program, 70-80% questions you have covered, 30% is new. Not an issue. I will do 8 questions I will revise every day. 2 new questions I will do every day. Till at the end of the second month of my revision, all the new questions are covered. Okay, so basically you have to have a plan. When you have a plan, when you have an action in place, and when you start acting on the plan, the fear will go out of the window. But you have to act. The fear is coming only when you are not taking any action. And along with all these things, even during the residency period, you should have a proper sleep. You should never, compromise with your sleep. Okay, you should always have a proper sleep, because if you have a proper sleep, you are able to better concentrate in your, in your day-to-day activities, and you're better able to observe and grasp all the things that is going around. So I have always maintained that along with reading, you have to do some kind of relaxation as well. Okay. But my caution over here is also that do not burn out. Why I am saying to you? Because this is the very first time that I am watching this thing. A very excellent student, okay, from South India. And the student knows each and everything in and out. Any slides we used to give, she used to have the best answers in the exam. But her problem was that she was, she always used to take everything very seriously. She was quite like a OCD, like obsessive compulsive. Means, she used to take every small problem as a very big problem, and she used to become hyper with all things. It is not her fault. Some people have that personality, okay, and I'm not blaming you for that. So sometimes what happens that even if you do an extra amount of work, like for example, out of 7 days, 6 days you are working hard, at least one Sunday you need to take a rest or a break. That student will read on Sundays also. So what happened that in the end, 10 days before the exam, her mind gave up. She told me that, for example, that I cannot, it is not possible for me basically, and I don't want to score a good number of marks. I am actually exhausted. Her body gave up, literally. So what happened that when she had given exam, okay, it is not like she could have been, able to, take, get distinction or get a gold medal, but she was not able to do that. Okay, she passed with decent marks only. But my point over here is that do not burn yourself out. And exactly this is what happens in the last 6 months when you have not opened the books in the last 3 years, last 6 months after thesis submission. Now everyone is doing the same thing. Seniors have done the same thing. Why I should not do? Everyone is passing. I will pass as well. So this is the basic bad trend which is going on, bad precedent which has been set up. Okay. So when everything you want to do in the last 6 months, okay, reading new things in the last 6 months, at the most 20-30% or 40% things should be new. 60% you should have read in the last 2.5 years. Okay, it should not be like 10-20% you have read and 80% is all new. When something like this is there, what happens that you have less time, you are in fear, then you are reading, you are forgetting, then you have that kind of worry. So things start going wrong in this pattern. So there is a trend, and remember, this trend did not start in the last 3 months or 6 months. It started right from your residency program. When the residency program started, you have not opened the book deliberately. This is, the sooner you accept this fact, the better the results will be. Okay. Point number 8, if you see, I have always maintained this one thing, that we as Simply Pathology, our app, our website, the content that we produce, what we try to do is we try to make it quite easy for the students. We try to guide the students that they go through the residency in a pattern that they are able to independently diagnose in the exams. This is what is important. But if you say that, sir, I am not going to do anything in the college, I have seen all of your videos 1,000 times and now I remember everything, word to word everything. That is not going to help you. I am myself telling you this. No other app will tell you. Apps are only going to tell you, you join and please, you come, join, then they will have multiple, small courses also. Even for last 15 days also, they will take out a course for earning money. And students are also going and they are buying. I don't know what is the point of that. So basically, I have always maintained, even if you see all of our videos and everything, okay, you have to go, take the slide, focus under the microscope yourself. You have to go in the exam, practical exam yourself. You have to do everything or no. So if you are not able to use a microscope properly, if you are not able to focus the things, recognize the things, so even if you see the videos 1,000 times and even if you pass outside, you will not be able to diagnose anything, and that defeats our purpose. That is why, if you are not going for the practical knowledge, if you are not attending the college, if you are not learning the practical stuff, and please do not give this reason that there is no one to teach. How the teachers can teach you? You tell me, can the teacher when it is coming, okay, in the college, she or he, they have to report so many slides. Have you seen the trays in the government colleges? Yes, apart from the from doing this patient work, they have to supervise all the grossing activity, all the practical activities which are taking up. They have to supervise that. Thirdly, not even that. Along with that, there are 1,000 other departmental activities as well. Seminar is there, so someone is the moderator. Thesis is there, someone is the guide. Okay, so they have to give time for that. Then also the faculties, they have to also they have to take the classes for the MBBS, for the dental students. They also have to take classes for other, for the BPTH, for the DMLT students. There are so many things. Then when exams is there, they have to conduct the exams also. Now, in top of that, do you think is it practically possible that every teacher will show each and every student, okay, this is the blood vessel, this is the squamous cell, okay, this is vascular invasion, this is peripheral neural invasion. So how do you learn? As I've already maintained, that you see in the, now for example, in my videos I have shown you lymphovascular invasion looks like this. PNI, perineural invasion looks like this. But you have just seen in the videos. You have to yourself be able to recognize under the microscope. This is very, 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 very important thing. And everyone, if you just give 30 to 45 minutes consistently every day, and if you see 5 slides also every day in the exam, you will be able to master the art of independent reporting in a span of 6 months to 1 year. So don't ratify or don't do the rote learning of these slides, please. You have to see slides every day. Now, every day doesn't mean that every day that you go. One day, maybe you have excess amount of work in department. Some days you have to prepare for seminar. That is all right. But, you get into a habit that I have to see. Okay, I have to see such slides. So, a pattern of slide reading, you learn how to read the slides. Okay. And remember, whatever points I have told you, if your seniors are saying, oh, you are in the first year, what you want to see slides? Oh, leave it. Any person who tells you, or any application, or any one person who says that, come, I will teach you, whatever I am teaching is more than enough, you don't have to, worry about your college, they teach, they don't teach, it is all right. No. Run away from that person first, because that person doesn't have the best interest of yours. Okay? You always have to go and see the slides. Even now, if you see, now all of you who are enrolled, I am giving so many slides. Now in our WhatsApp groups, if you see, there are 1000 plus residents who are in our WhatsApp group. Now, whenever I give a particular slide for the students to describe, do you know what is the rate? Only around 100 to 115 students they will write. Okay. Now, the rest of them, there can be 2 scenarios. Either you know everything, okay? In that case, if you know everything and if you think that it is a waste of time, why I should sit down and I should write down? I know it. This diagnosis, it is all right. For them, it is all right. Yes, really. If you know how to write, if you are confident about your writing, if you know the diagnosis, you are correct, then why will you waste your time and energy writing down? Yes. This is done mainly for giving you a platform and opportunity to write down, to practice. Once you write, okay, then you will understand something. Second time you write, you will understand more thing. Third time you write, okay, you will become more and more fluent. So you should get into a habit of writing down and describing your answers. This is very, very important. So the second situation is, or you don't know anything, okay, and you do not want to work hard as well. So this is the basic thing that I'm trying to tell you. Always I'm telling you that learn how to write. You will not get such opportunities, and no one is going to sit and see all of your answers, and no one is going to tell you, okay, even if you are writing a wrong answer, it is not a problem. Okay, we are giving you descriptions, or no, you go to the description, see where you have made an error and then try to rectify it. There have been students from the first year who did not know what to write in the first year, and they were damn scared. Today, I think 4 days or 5 days back, okay, the student is in the second year. He is one of the best students, okay, being in the second year, he can diagnose better than the third years, because from the first, he has been writing down, he has made an attempt to write down the diagnosis, the impressions and everything, okay, and currently the student has got so many awards, who has given the case presentations. Now, this particular student was a very weak student, did not know anything, and was, quite afraid and apprehensive, at first. But now the student has done very well, and I have seen the student's journey from being nothing to becoming something better than even some of the third year students who have passed out. Okay. So this is what our goal is, that you become an independent reporting pathologist. That is the most important goal that we have. Okay. Now, some of you have always raised a question that, sir, why in Simply Pathology you are not giving us, how in other apps they're giving. Okay, this is one question from us, or one exam pattern from us, because what happens, the other apps, if you see, they are making questions for a nationalized exam. So when a uniform, I'm especially speaking about the MD exam. Now, if you see, there are more than 100 universities. There are more than 100 deemed universities. So if you see, there are more than 200, 250 universities in the country, including the deemed ones, who have their own set of question paper. And no one is following the NMC properly. all of them, they have different, I'm not saying that, all the questions will be different, but few questions will be important. Like for example, certain questions which are important in West Bengal, which are repeated in West Bengal, they might not be relevant in Maharashtra. Similarly, some set of questions which are repeated in Maharashtra, they might not be relevant in West Bengal. So that is why this is also one of the reasons that I tell you to see the last 5, 6 or 7 years of questions. Now, what we have done to address this, we have come up with the 90-day 90-day revision program, wherein we have discussed the exam pattern as per the NMC guideline. Okay, their passing rate, how much is the passing marks, as well as we have also given all the list of important topics in details in the 90-day program. Along with that, I have also given a dedicated video how to approach the recent advances along with all the topics. I have given all of them, and all these things are discussed in the app. Everything is available. Okay, even if it is not, you don't want to go through the app, just see the questions that I have given you and you go and solve them from whichever source that you get hands-on. Okay, so very important, the future plan, in Simply Pathology, we have a future plan to conduct the theory as well as the practical exams. Mostly this year, we will start off with this. We will have one theory exam just for the practice, that you see how you are able to write. Okay, and also practical exams, we will see whether how to implement the practical exams online, how it can be done. We are working through that also, but mostly for the theory we will be giving in this particular exam exam only, we are going to give a theory exam for them. Okay, now all the list of important topics, as I told you, I am going to give the link to the video to the 90-day revision plan video. Now, before I end, there are two important aspects I will discuss, some of the very important or some of the harsh truth that you have to face. So remember that in your residency program, you are the only one who thinks about your interest. So it is, don't get into the hope that my guide or co-guide or HOD, my senior or my colleague or anyone over there in the department is going to think about your interest. No. Why am I saying my batchmates as colleagues and not friends? Because those colleagues, they do not have, they don't, that today if they go and see one important structure, some teacher has shown them some important structure, they will not come and tell you as a friend that today I have seen this, you also go and see. Very less, few will do that. But you have to see what is going around you. What teachers, sometimes in your department when the teachers are reporting, they might show you one or two things. Okay, so you just see over there. You see under the microscope, you see what you have written, whatever slide descriptions your faculty member has given. Okay, maybe they don't have time to show each and everything, but you have to go, you have to see the entire slide under the microscope and match whether this thing is this or no. Or they have written, for example, the tumor cells are present in sheets. So what is the meaning of presence in sheet? I have made a particular video how to write histopathology slide description. Okay, so go and see what do you mean by solid sheet, what do you mean trabecular structure, what do you mean herringbone pattern, if they have used such words. Okay, see the description and match it. You see image, you match, you see and match, and this is how you learn. Very simple. So you are the only one who thinks about your interest. So if anyone or any senior, junior, faculty, any person tells you, you are in the first year, why you are reading so much, why you are taking so much attention, remember, first year is the only time where you will have maximum time for your reading. Not in the second year, not in the third year, you will not have such amount of time. Second thing, all the departmental work, all the clerical work, okay, exam duty work, seminars, journal club, poster presentation, all these things, they are fine, they are good at their place, but they should be a part of your residency. They should not be the entire, or they should not be the definition of your residency. Residency is supposed to have all these things, but along with that, you yourself have to start looking at the slides. You yourself have to go through the textbooks or any source of information. You read it and then you have to apply that knowledge. It is not like, okay, today I read about, I saw a slide of breast carcinoma, so I read about breast carcinoma, I finished. No, you saw many things. Which type of breast carcinoma you have seen? Okay, what is the histological features? Whether in the books it is something like this, okay, over here, okay, more or less it is matching. Okay, few features are not there, but maybe the next slide you see, you are able to get all the features as well. So no one can do this particular part. This particular part actually should comprise 60% of your residency, and all this work that is there, everything should comprise 40% of your residency. Okay, but 60% should be this work. Now, also one thing I will tell you, that passing is not a big deal. Okay, as I told you, especially for the MDs, passing is not very difficult. It is quite easy. You will see that there is a more than 96 to 98% pass percentage rate. But remember, it is not a cakewalk also. It is not like you just closed your eyes, one day you woke up, went for your exam, wrote anything and anything as per your wish, and you will pass. No, it is not a cakewalk. In the 3 years, during the exams, the examiner can gauge very well who has worked in the last 3 years and who have not worked in the last 3 years, who have read and who have not read. If you are not able to recall something, okay, they will understand, because it can happen, because during the exam there are 1,000 things to look. Okay, but one more thing is there. Why am I telling you these things, that exams are not easy and don't take them as a cakewalk? Because if you don't pass, you will not get a degree. If you don't get a degree, there is no earning. So you have to sit and you have to repeat the process once again. So I know this is a very harsh truth, and I'm not trying to demotivate you. I am trying to give you a real situation. Okay, and 95% of whoever is watching the video, I know you know all these things. Just I am repeating these things in front of you so that the idea is clear as to what you have to do. Don't fear, start acting. Now, also one thing, there are many students that I know that, for example, they don't know anything, yet they have passed the exam, and when they have gone for a job or something, then actually they are actually asking, sir, I want to enroll in your app, sir. I want to see and I want to learn. Why? Because when you have to earn money, you have to report, and for reporting you should have knowledge. So if you have not read, you will not have that particular knowledge. So again, you will go to SR-ship, you will learn under someone to become a professional, and then you can become independent. So you are losing a lot of time in SR-ship. Under 1 year, 2 year, 3 year, you are wasting time. So at the point when you are passing out, you are confident, you join a lab. Okay, work under a particular consultant, but yourself be a junior consultant also. You know what I'm trying to say? This is very important. Now, some silver lining or ray of hope. Now, remember, please don't take this that I'm trying to promote my application or anything. What I'm trying to tell you is to make you understand what is our goal and what should be your goal when you are, a resident in the field of pathology. And especially this is very important for the first and the second year individuals. So I want you to go through these words. So certain part of that things that I want to give you. So leave these things. I want to concentrate on one particular point, that sir, I was able to make 26 out of 28 correct diagnoses in the practical exams, and rest 2 were not wrong, but the examiner led me to the final diagnosis. Now read this other part. I don't want that you believe like that to me. So there are two things, that once you start reading properly, okay, once you see all the particular images, and remember, do not get stuck to one image. Suppose you have seen breast carcinoma today. So many students, they say that, sir, please give all the exam slides in the exam slide section. I want to see and I want to ratify everything. That exam section and exam slides, they have been given to give you an idea how to write an answer, how to, completely see all things. So basically, I do not want that, there is a set of all, okay, these are the pictures for this particular. So what will happen, that always you will see those images and you will try to find those images only in the exam. So even if you have seen an image of, for example, Hodgkin's lymphoma nodular sclerosis variety, you have seen, I have shown you one image and that image only is stuck in your mind. But for example, in the exam, you might get the same diagnosis, but it would be a little bit different. So you have to see multiple pictures. You can see multiple pictures across the internet, multiple pictures in multiple books. So the more images you see, the better your memory will be. Okay, the better understanding will be. See over here, one student had never seen a slide of chordoma, but in the exam she was able to diagnose even without any time looking at those slides, because she had seen that slide somewhere, in the pictures. So it is not like if you have not seen all the exam slides, you will not do well. How this student was able to diagnose all the slides. Now, one other thing you see, this is one of our students from Simply Pathology. Our external was from PGI Chandigarh, and she observed the difference among the students in our batch. She noticed lack of uniformity in knowledge and approach level between all PG students. She also commented, it seems self-directed learning, but we had your back, that's why we achieve whatever. I have cut because the name of the student will be there, that I don't want to give. So basically what is very important over here, that you have to understand that no matter where you are, in whichever college you are, if you are reading as we have directed you to read, and if you are consuming knowledge the way we have directed you, and remember, most of these, not most, 100% of these reviews that I am sharing with you, these students have been enrolled for more than 1 year in Simply Pathology. Now, I'm not telling you that you have to come and join and be with us. Another important thing is that you don't join us, but at least go through the guidance that we have given you. And at least you read from some sources about that and prepare accordingly. If you give more time, then you will learn also better. Okay. And always remember, okay, like this student also, that cleared the exam with around 68%. 68% is not less at the level of MD. Please remember what the student has written. Understand, this is what our goal is. It is not about the marks, but the concepts are made strong. So this is very important. I was able to answer and diagnose better. So these are some of the important aspects that you have to keep in mind. This is another student. Now I will tell you the story of this student. Okay. This student could answer 12 out of 15 histopathology slides in practical. Now this is an excellent student, very good practical knowledge, was an MD student only. But what happened with this student, that in the end, her center for the practical exam was not the home college. Her center became another MD college. And she was asked to go, I think 2 days before the exam, this information she had got, that no, your center will not be here, you go and give exam in some other college. Now think, a student, okay, is not in her comfort place. She had to go and give exam in another MD college, in another medical college, and yet she was able to answer properly. Okay, the basic thing is the basics were made stronger. Okay, so what I really want to tell you, and I'm not taking the credit out of anyone, it is not our credit. We at the most can make the best content. You have to eat it, reproduce it, and apply the knowledge. Okay, so the real heroes are who? The residents are the real heroes. Okay, we are not the real hero. We have just taught you everything, given you information. It is up to you how you will utilize that knowledge and how you will apply that knowledge. We are there just to guide. Okay, and what my aim is, that from these messages, that you should learn that what your aim has to be. Okay, so become an independent pathologist at the end of your residency program. Okay, just remember, only theory can never achieve this. You have to apply the knowledge. So I hope this particular session was a productive one for each one of you. And if you have any doubts, you might write down in the comments, or you might also WhatsApp us. Okay, so thank you very much for listening to this particular video.